Calling 911 does not skip the ER line, but knowing how triage works might. There are three things the ER decides about you in the first 2 minutes, and none of them are how you arrived. So, how ER priority is decided? Emergency department use triage, not arrival method, to decide who's seen first. Patients who arrive by ambulance are triaged the same way as the walk-in patients, based on how sick or unstable they are. Calling 911 does not automatically mean you'll be seen faster. That said, calling 911 does make a difference when your condition is time-sensitive or life-threatening, such as chest pain or chest pressure, trouble breathing, stroke symptoms, seizures, severe bleeding, loss of consciousness. In these situations, paramedics can begin treatment immediately and notify the ER before you arrive. The ER team will be ready the moment you arrive. But that's because of acuity, not the ambulance itself. Common myth that is worth clearing up: some people call 911 hoping to skip the line. In reality, ambulance patients can still wait. You may be triaged directly into the waiting area. What happens during the triage? When you arrive at the emergency room, one of the most important things you will be asked is your chief complaint, the main reason you came in today. This helps the nurse quickly understand what's going on. Emergency nurses are specially trained to assess patients for time-sensitive conditions and safety concerns. While we understand that everyone who comes to ER is experiencing a crisis, patients are selected for care based on the level of acuity or how urgent their condition is. Bringing a list of all your diagnoses and prescription and over-the-counter medications and supplement list will help your care team treat you more quickly, reduce the risk of medication errors, delays in care, and unsafe treatments, especially when you're stressed or not feeling well enough to explain everything. Please check out the previous video where I explain how to get ready for a medical appointment, and I provided a medication table link. When you enter the triage room, staff will obtain your vital signs and accurate weight, either on a standing scale or bed scale if you're unable to stand. This information is essential for weight-based medication dosing, especially in emergencies. You may be asked to refrain from eating or drinking until a provider evaluates you. This is important because some tests or procedures require an empty stomach for safety. If you eat before being seen and a procedure is needed, your care may be delayed by 4 to 6 hours to allow your stomach to empty. It's a good idea not to eat before you're going to the emergency room. If you're here for abdominal pain, back pain, staff may ask you to provide a urine sample early in your visit, so it is always important to stay hydrated. This helps to speed up testing and avoid unnecessary delays later. In some situations, X-ray may be obtained while you're still in the waiting area, if appropriate, to help to move your care forward. When you're sick and waiting in the ER, it can feel like you've been forgotten. But there is much bigger picture unfolding behind the scenes. Please know the emergency department is always receiving patients also by ambulance or police, many of whom require immediate care. What's also important to note from being on the other side of ER experience, emergency care works best when the staff efforts being acknowledged. ER teams are working long hours, often understaffed, especially during busy seasons. While this is the work they've chosen, they deserve the same compassion they try to give every day. Please treat ER teams with respect, offer kind words, and recognize how busy they are. Your patience and politeness won't go unnoticed. Knowing what to expect in ER and how to communicate clearly can make a real difference in your care. I hope this helps and take some of the mystery out of the ER. And if it did, please share it with someone you care about, because knowing how system works can make a stressful moment a little easier. Please leave a comments sharing your positive or negative experiences with ER, how you handled it. Your comments and experiences might help someone in the YouTube space. And I'll be happy to answer any questions you post in the comments. If you found this video helpful, hit the like button, share it with a friend, and subscribe for more mindful health tips. And remember, joyful heart is the best medicine. Stay well. Till next time.